Hello, welcome to the College of Health and Public Services at Daytona State College. My name is Dr. Colin Chesley and I'm the Associate Vice President of the College of Health and Public Services. The college houses the Bob and Carol Allen School of Nursing, the School of Health Careers, the School of Dental Sciences, and the Charles M. Curb School of Emergency Services, which each provide a range of vocational, associate, and baccalaureate degree programs. Our programs are led by highly qualified teams of faculty with practical experience in their respective fields. We're also closely aligned with our community partners as they provide learning opportunities for students at their hospitals, nursing facilities, clinics, labs, and other patient care and emergency service areas. Students receive hands-on training in these facilities with experts who hold specialized licensing and certification, as well as in our very own state-of-the-art patient simulation labs and emergency service labs. Most of our programs hold external accreditation above and beyond our regional accrediting body, and they boast professional licensure passing rates that far exceed national averages. This is our medical coder biller classroom. Every time a physician or clinician sees a patient, they need to record what they have seen and done. Medical coders and billers don't see patients, but they do ensure records are correct, that clinical notes are coded and documented properly, and they work with insurance companies to get paid. Here you will learn how the clinical functions and administrative functions of healthcare intersect. Respiratory therapists care for patients who have trouble breathing, for example, from a chronic respiratory disease such as asthma or emphysema. Their patients range from premature infants with undeveloped lungs all the way to elderly patients who have diseased lungs and everything in between. They also provide emergency care to patients suffering from heart attacks, drowning, or shock. RTs work in hospitals primarily, followed by skilled nursing facilities and even some physician offices. Many times when you go for a medical appointment, it's the certified medical assistant who prepares the room and equipment, gets your vital signs, assists with the exam, and then ultimately enters your patient information. They can even provide injections, draw blood, and prepare other samples for lab work. They may also work in many of the administrative functions of the office. CMA is the third fastest growing profession in the state of Florida. As I mentioned earlier, the College of Health and Public Services includes the School of Dental Sciences. We do want to briefly introduce you to dental assisting. Dental assistants have many tasks, including patient care, record keeping, and appointment scheduling. Dental assistants often spend much of their day working closely with patients and dentists. For example, dental assistants might take a patient's medical history, blood pressure, and pulse before a procedure, explain what will be done, and talk to patients about oral care. Dental hygienists have additional and expanded duties from dental assistants. They examine patients for signs of oral diseases such as gingivitis, provide preventative care, and they educate patients about oral health. They remove plaque from teeth, apply sealants and fluorides, take and develop dental x-rays, document patient care, and they report to the dentist. Dental hygienists use many types of tools, including hand, power, and ultrasonic tools in their work. Have you ever watched a TV show where they are in the operating room performing a surgery? You may think that all of those people assisting the surgeon are nurses, but they're not. Some of them are surgical technologists. Surgical technologists assist with operations. They prepare operating rooms, arrange equipment, and help doctors during surgeries. Before an operation, surgical technologists prepare the operating room by setting up surgical instruments and equipment. During an operation, surgical technologists pass the sterile instruments and supplies to surgeons. They might hold retractors, hold internal organs in place during the procedure, or set up robotic surgical equipment. Radiologic technologists, also known as radiographers, perform x-rays and other diagnostic imaging examinations on patients. Rad techs are trained in the use of different types of medical diagnostic equipment. They may choose to specialize, such as in x-ray, mammography, or CT imaging. Some techs provide a mixture for the patient to drink or give injections that allow soft tissue to be viewed on the images that the radiologist reviews. Our diagnostic medical sonography program is located in our new building on the Deltona campus. Diagnostic medical sonographers operate special equipment to view the soft tissues of the body and conduct tests. Sonographers specialize in creating images known as sonograms or ultrasounds that depict the body's organs and tissues using high-energy sound waves to view the inside of the body. The sonographer uses an instrument called a transducer to scan parts of the patient's body, which emits pulses of sound that bounce back, causing echoes, much like sonar. Sonographers prepare patients by explaining the procedure, preparing the exam rooms, and maintaining diagnostic equipment. They situate patients for imaging, operate the equipment, review images and tests to check for quality, and analyze the results of the tests for abnormalities. Sonographers work closely with physicians and surgeons who view the images and results to assess patients' conditions and diagnose medical conditions. Occupational therapy assistants, or OTAs, collaborate with occupational therapists to develop and carry out a treatment plan for each patient, helping them regain motor skills. Plans include activities of daily living, or ADLs, such as bathing, dressing, toileting, and generally caring for their own needs. OTAs also may work with people who have learning disabilities, teaching them the skills that allow them to be more independent. Physical therapist assistants, on the other hand, sometimes called PTAs, work under the direction and supervision of physical therapists. They help patients with mobility and ambulation who are recovering from injuries and illnesses to regain movement and manage pain. PTAs treat patients through exercise, massage, gait and balance training, and other therapeutic interventions. Emergency medical technicians, or EMTs, and paramedics care for the sick or injured in emergency medical settings. People's lives are often at stake and depend on the quick reaction and competent care provided by these workers. EMTs and paramedics respond to emergency calls, performing medical services, and transporting patients to medical facilities. Massage therapy is a therapeutic approach to healthcare. Massage therapists treat clients and patients using touch to manipulate the muscles and other soft tissues of the body to relieve pain, assist healing from injuries, improve circulation, relieve stress, and help the general wellness of the clients and patients. The program only takes 1 academic year and will train you in anatomy and physiology for massage therapists, pathology, hydrotherapy, and clinical practice in our very own massage therapy clinic. And finally, nursing. Registered nurses, or RNs, provide and coordinate patient care, educate patients and the public about various health conditions, and provide advice and emotional support to patients and their families. Additionally, RNs assess patient conditions, record medical history and symptoms, administer medication and treatments, set up care plans, work with physicians and others from the interdisciplinary team, and help perform diagnostic tests and analyze the results. There are several specialties in nursing that range from cardiovascular nurses to critical care nurses to neonatal nurses and public health nurses. I encourage you to contact our college for more information on the excellent programs and services that we provide. Remember, every minute, every day, there's a Daytona State College graduate somewhere who's impacting the health and safety of our community. No matter what health or emergency services career you aspire to, Daytona State College can get you there. Come and see what the College of Health and Public Services can do for you.